Welcome to our online around the world talking about the public health associated with the war between Ukraine and Russia. You know, this is a not a good sense when you see the war in the war. As you have already know about the goal, the Sustainable Development Goal set by WHO. The ultimate goal is to reach the partnership. Today, we can see if we have the war, then this is very difficult to reach, the goal of the SDG, because the item before the final goal of reaching partnership is to look for peace. So, as a public health professionals like me, I'm a professor from National Taiwan University College of Public Health. My specialty is pertaining to epidemiology and also preventive medicine. So I'm obliged, to take these opportunities through this online to advocate the law of the public health for stopping the war. I know public health already in the USA over the past decades has been already recognized as one of the very important agents for anti-war. But I think this area still has been neglected, because whenever we have a war, the women people sometimes, hadn't make use of this opportunity to use public health to prevent the war. Had the public health been used to intervene, before the war, probably the Ukraine and the Russia war would not have been seen, like now. So today, I would like use the topical the public health facility piece for sharing with all the audience from the world, to let you know, public health is still a good means for stopping the war in order to reach the goal of the of the SDG. And this is my purpose of this online. And we are going to continue this online, every week at the 10 o'clock on Monday morning. We wanted to systematically, to report such kind of the topical from the complex humanitarian emergency, which is abbreviated as CHEAs. So today's topical is just the prelude for preparing our public health, playing the role as the professional for prevention of war. Our slide and the information will be shared after my presentations on YouTube with the link, as you have seen, in this slide. And we have also ceased, the broadcast of the Hansen broadcast with our, the the director of the broadcast, Miss Mei Shao Wen, who is the chief director of this broadcast, and has been long collaborating with our team to have a broadcast on the COVID-19 pandemic. So the same link will be used for linking, our topical and all our content of this presentation with the audience from their broadcast. Of course, the detailed press content in Chinese will also put on link, as you have seen in the final row of the website. I think everybody know the law of the public health with the 3 level of preventions. As I mentioned earlier, even we cannot stop the war, but we can still use any means of the primary preventions, including negotiation, including the advocating, the group, including the lobby group, to join with any opportunity, to stop the war as soon as possible. So this is called the primary prevention of, of making, the war stop as soon as possible. The secondary prevention, of course, is trying to mitigate and to minimize the casualty during the war, particularly, for children and also for the women. And the third level of the tertiary prevention, of course, we call it a rehabilitation after war. This means, after wars, many institutions, particular hospital, healthcare system, and also the important facilities will be destroyed, and how to build up and how to renew the system to return to the, the normal situations, and the need the rehabilitations. And this 3 level of the preventions, is our preparation of the public health, which we can make every effort to minimize, the loss resulting from the war. And so epidemiologists, each week, we will report the casualties from the Russian-Ukraine war. I understand such kind of reported figures would be underestimated. But I think, we still have obligation, to report this injury and also the deaths. Until 14 March, you can see the cumulative injuries reaching 957, and deaths approximate reaching 549. Of course, these are related to the peoples rather than the soldiers, because you understand, once you have a war, the reported the injury and also deaths from soldiers would not be very accurate, because both sides will be very conservative to report their figures with each others. So the estimated number of days from the soldiers can only be fully investigated after all through the following, the research institute or the long established institute for reporting, the casualty of the war. So this is called the evidence-based evaluation for casualty of the war. And sometimes, you see, if you want to estimate the days from such kind of the armed conflict in a way of the civil war or the war, like the international, the war, there are so many ways of reporting such kind of estimate. From the left side, you can see until the right side, you see you can use the demographic, studies based on the census data. You can also use the civil registration, population registration of the vital statistic. And of course, you can use the survey, after war. Or even you have to also refer to the figures reported with eyewitness on site during the war. And of course, each of the ministers of the defense of the foreign ministries will also be responsible for reporting such kind of figures. So all kinds of data will be integrated to estimate the magnitude and the impact of the war. Through these information sources, the immediate the reporting system, of course, is through the mass media, the press resources. So that's why sometimes, in terms of the quality study viewpoint, then we need still rely on the press. But in order to validate the accuracy of information, this is not good enough. In terms of the evidence-based evaluation, you still need very strong, the project or the institute. Like you see, the correlate of the war project is called the COW, or the conflict of the data, the project from the Uppsala University in southern Sweden, and also you can also, through the interdisciplinary research programs on root cause of the human rights, violation, it's called the PIOO, the OOM. This is the project, to talk about the international, research on, the armed conflict. And of course, you can also use the Plowshares project. So this research project and also the database can be used by the institute of the following the institute from left to right side. These include, the Heidelberg institution, from Germany, and the Center for Systemic Peace, major episode of the political violence database, and also Stockholm, the International and Peace Research Institute. And of course, from all epidemiology viewpoint, we have also the Center for Research on the Epidemiology of the Disaster. It's called the CRED, the EMG database. So this is what I'm trying to emphasize is the primary, secondary, and the third level of prevention of public health have to rely on the strong evidence-based evaluation through, these information sources and through this reputable, project used by the institute. Then every university, whenever you want to do, the evaluation of the impact of water, we can collaborate with these famous, and also the reputable institute, particular from our public health. We try to have the interdisciplinary collaborations, and this is what I'm trying to also to follow this pathway, to evaluate the impact of war in the futures. And I will share, my my synthetical, the the framework from such kind of research with all the audience. And I think this is very important to use science to support the minimization of loss as a result of war. Because of this evidence, research institute and project, then they can calculate and estimate the number of days from the war after 1990s. I mean, the scale of the very, the scale and also the size of the impact are very heterogeneous. You see, there are several kinds of wars, either from civil war or from the international war, particularly for the the Gulf War between 1990 and 1991. That's why you can see the impact is quite substantial, from about the 403,000 days until the until 100,000. Sorry, 43,000 until the 100,000. So the range of the number of days is quite heterogeneous, and we are going to report in the futures to compare the size of the number of the days with these estimated number of days before, and that's called the epidemiological rule. Epidemiology analysis about the days from the war. And epidemiology also analyze the data by age and gender, which I think very meaningful for the production loss of society and also the health impact because of the war. And you see the majority of the days between age 15 until the 45, because those age group, belong to the young male. But we cannot also neglect the female loss, although they are low numbers compared with the male. Don't forget, because most of the days from the young male belong to soldier. So during the war, the female loss, most of them, come from the migrations, and of course, this also affect the children's. You can see, in the following analysis. So age and the gender specific days is very worthy of being investigated during the war, after the war. And of course, when war continues, the most emergent things to do from the viewpoint of WHO, from the UN, and also from the world, from each organization in the world, would require the following the following things, including oxygen. Oxygen is very important, not only have seen in the COVID-19 pandemic, but also for other people need of the ICU and or need of the medical imaging crisis. And of course, because of the war, the trauma has been substantially created. So they need to many devices, many medicines for dealing with the trauma. This include, the medical bandage, morphine, and so on, to control the pain and also to relieve, the the burden of the injured soldiers and also the patients. And during the war, the healthcare system is disrupted, and for chronic disease like the cancer and also the diabetes patients, for example, cannot continue the normal cares. So they would result in the premature days, to lose a life. So the medical sources is quite urgent need, like the insulin, for examples. Of course, and also other, the medicine or the medical facility for keeping these patients with normal medical cares. And we are going also to talk about, the tragedy of the war that led to the deficiency of the basic need for food, for the water, the clean water, and also the power supplies. And this is all the things which immediately urgently, needs to be provided. That's why UN and also so many the organizations, including the close, particularly for the close organizations, the Red Cross organizations, they make much efforts to ask the support, the donation for supplying these these urgent required facility and also materials, transporting to those who in need of these. And this is called the urgent need for reducing the injuries during the war. And WHO had already the disease burdens because of the armed conflict. So you see, from Africa, America, and the European and the South Asian and the Western Asian Pacific, total number of days they already calculate. So the percentage on average is about 0.56. So it still, means something. But as you can see, in Africa, they have a continuous civil war. So that's why the proportion of the total days will be the highest, about 1.58, until and the military the areas, the eastern military area is about almost 1. And not only for the days, but also for the disability life years. You see, it's about 10,000, and the percentage is about 0.7. And of course, it's still high in Africa and also Eastern Mediterranean area, with 1.55 and 1.02. So these burden laws would have been avoided without fault, but unfortunately, may still pose the burdens on the society around the world. And these figures were estimated in 2001. We are going to see how UN and WHO report this Russia and Ukraine war conflict, and that would be also detrimental life loss during the war. And this is a direct of the loss, not to mention about indirect loss because of the productions loss in societies. So from this viewpoint, we can see the public health and particular epidemiology, and also the global health for estimating global disease burdens play important role in evaluating the impact of war, which can be used as one of the criteria for persuading the people side to have a timetable for reaching peace. So I would like to introduce, based on the previous experience and also suggestion from the USA, about the 10 professional criteria on public health related to the prevention of the war. That's very important for our public health professional, and not also very important for decision makers, and not also important for politicians, and also a leadership in the world to consider using public health as a negotiation and also the the criteria in terms of the health humanity or the humanity emergency aspect to end the war as soon as possible. So the first items about this professional in public health is we are tempted to suggest that prevention war will become the core ability of public health. It means, in the world, every universities and every organizations, you can also incorporate public health is one of the core ability as a essential element. And of course, prevention wars has been prioritized as the professional education of the public health in the USA, as far as we know from ASPPH. The ASPPH is the union of the American of the public health school in the USA. They strongly, unify all the public health in the university and organization around the world to advocate the professional core ability and also advance skill to use public health for reaching the goal of the SDG. So in order to reach this purpose, the third element, of course, we need to have the good measurement, the measures and educational course in relation to the prevention of war. And this course and also these measurements, these measures can be incorporated into fundamental public health organizations. Then once we have core ability and we prioritize this as the basic element of education course, and we have very good measures and educational course, then we can have interdisciplinary collaboration with other professionals for entire world. And to this end, we have to apply the public health professional to the prevention of war. This is particular for using epidemiology, ethical code, and any prevention measures and strategies. And as I mentioned earlier, because I'm a professor in the epidemiology and prevention of the Institute, College of Public Health. So I think epidemiology and the ethical code and also the preventive medicines can be applied, to reaching the goal we have already set up whenever we want to open a course and the educational course for the relevant organizations. And once you have such kind of skill and ability, then we can do the health impact assessments for evaluation, the influence of the war and public policies. In addition to evidence-based framework for estimating the number of days, as you have seen in the previous slide, from the different subject and institute, I think our public health can focus on how the world, impact the public policy, like the vaccination schedule, like the healthcare system, and how like the continual, the care for chronic disease patients. Then we can, mitigate the secondary prevention strategy about the minimization of the casualties. And the important things, once we have such kind of the evaluation, we have such kind of the course, then the professional in the public health was sent up to advocate the anti-war by unifying the interdisciplinary people with public in order to promote peace. And I know, people always, talk about the impact of war, the size of the loss of the war from the military viewpoint, from political the political system viewpoint, from the economic system viewpoint. But public health perspective incorporated into the law, the prevention cannot overemphasize, and had better be rooted in the primary school educations from childhood. And that's very important when your young generations, have witnessed the Russia and the Ukraine war. When you are in this stage, then when you get older, you learn the lessons. You never make a mistake to have the war. And this requires people around the world to pay attention to not only public health. So the global health landscapes for anti-war become the first priority of the public health from now. And that's why we have this online broadcast to share our our viewpoint with all the audience. If we can do so, then you can see again the WHO that set up the 17 items for SDG, from zero poverty, zero hunger, until the 17 partnership, as I have mentioned earlier about the partnerships. And please pay attention to item 16, peace, justice, before the partnership. So if Russia and the Ukraine war still continue, it's continue to violate the principle of the SDG item 16. So we strongly advocate health is a good means for reaching peace. And thank you so much for listening, to our online video. Thank you so much.